Yeah, I'll take it out in my phone.
So, ma'am, should we start?
Yes, if all our speakers are here, please do so.
Speakers are here, ma'am.
Let us start then. Thank you.
Good evening, everyone, and thank you for joining us for this very important discussion that we have today on domestic violence. Every year, millions of people all over the world are victims of domestic violence. There was a very popular campaign a few years back, if you remember, that if you know someone in a situation that is unsafe, ring the bell, or ghanti bajao as in Hindi. The campaign was launched in India in 2008 by Breakthrough in collaboration with the Ministry of Women and Child Development, UNIFEM, and the UN Trust Fund. The campaign promoted individual action against domestic violence. The COVID situation seems to have made this situation worse. Today, we're gathered here with our experts from Oxfam and UNICEF to talk about the gender based violence and the socio-economic impact of the same. May I now introduce to you our national president. Janbi Fukan is an entrepreneur and co-founder of two national award-winning travel companies in Northeast India with over 3 decades of experience behind her with Jungle Travels and the Assam Bengal Navigation Company under the JTI Group. She's very passionate about sustainability and she's created a platform called Cognac, which works towards promoting the artisan and weavers of the region in its signature out of Northeast India, curated collection since 2008. She wears a lot of hats, but she's asked me to keep the introduction short. So over to you, ma'am, for your address.
Okay. Thank you very much, Rashmi. A very good evening to all here. To my, on behalf of FLO, the women's wing of FICCI, I'm delighted to have you all here on behalf of the 17th chapter and some of the past presidents I can see who joined us today. So on the eve of Human Rights Day tomorrow, it is my honor to present FLO's small contribution towards the global campaign, which is going to culminate tomorrow. The 16 Days of Activism Against Gender-Based Violence Against Women is an international campaign originating from the first Women's Global Institute. This was started in 1991, and the campaign was kickstarts on the 25th November each year, the International Day for the Elimination of Violence Against Women, and it continues till 10th December each year on International Human Rights Day. The dates for the campaign were chosen to link violence against women and human rights, and to emphasize that gender-based violence against women is a violation of human rights. So over 6,000 organizations in approximately 187 countries have participated in the 16 Days campaign since 1991. We've had a reach of over 300 million people. This year, the campaign increased its efforts to amplify the voices of women workers in the informal economy while continuing to call for the ratification of the ILO Convention 190 and to ask for to seek an end to all forms of gender-based violence in the private and public spaces. We at FLO have joined the campaign this year for the first time, and with multiple partners which we found within our own organization, within our own very own members. We have Hamara Bachpan Trust, which organized the awareness campaigns, the gender audits to mark safe and unsafe places, signature campaigns, open mic programs, street plays, door-to-door campaign, virtual events, and charter of demands, recommendations which were submitted to the city and state governments. This NGO is run by our very own chapter chair from Bhubaneswar, Dharitri Patnaik, and I will ask Dharitri to run us through the solid groundwork achieved in the campaign so far after this. We also have our FLO Kanpur chapter chair, Dr. Aarti Gupta, who launched the Teach Them Young programs on 28th and 29th of November during this campaign. This was aimed at training teachers across India so that they are able to address the issues of gender sensitization, cyberbullying, and internet safety. If we train the teachers, they will reach out to the students And this is going to be an ongoing effort from us. Dr. Aarti Gupta also conducted the POSH workshop, Prevention of Sexual Harassment. And these workshops have been interactive online workshops for college students across the country, and she received a great response. And this will also be a continuing effort from Flow. We have another young Flow member, white Flow member, Achal Sethi, who has now volunteered to continue on our campaign along with her efforts on the campaign that she runs, which she calls Nahi Means No campaign. So we look forward to Achal to also join us in this effort. And I welcome each and every member of Flow to please come forward and take this up, because this campaign belongs to all of us. And the organization Flow belongs to all of you. And the way I see it, each of us at Flow have a role to play. Those of us who have NGOs, who have organizations, are being able to contribute this way. But all of us otherwise, in our homes, in our offices, in our daily lives, can practice this and raise awareness against injustice for women against every form. We can practice it consciously, starting from within our own homes, sensitizing our own members, our own larger families, our own communities. We all each have a part to play. And I'm delighted also that our Flow legal cell has been able to put this program together. So thanks to our Flow legal cell, we now have the privilege of listening to the voices that matter on this global war against gender-based violence. They will take us through the socio-economic impact of domestic violence, a frightening reality around the world. We look forward to their deliberations, and I urge you all, dear members, to raise your questions after that. But before that, let me take you through our efforts at Flow on this global issue, and I request Dharitri Patnaik to please do the needful. Thank you. Dharitri, please.
Thanks, Jahnavi. Anshu, will you be playing the slides?
Yes, yes.
Violence against women is rampant all over the world, and India is one among the list of countries which is at the top. And to prevent through building awareness, supporting the survivors through legal protection, ensuring their well-being through mental health interventions, and ensuring the rehabilitation through social security measures, Hamara Bachpan Trust, a pan-India NGO, observes the 16 days of activism against gender-based violence every year and takes different measures to create awareness to prevent all forms of violence against women and girls. And this year, Hamara Bachpan has partnered with Flow, the women's wing of FICCI, to observe the 16 days of activism by strengthening actions and resources to address violence against women in informal economy as part of the response to COVID-19, aligned to this year's global theme, addressing violence against women in informal work space. So we had a very ambitious program to reach out to 1 million people through this campaign, which we call 1 Million Rising. But I'm sure this is not the end of it, the 16 days. And with Jahnavi's permission, I would say that Flow would carry forward this campaign beyond this 16 days so that we reach out to as many people, men, women, children, government officials, everyone who matter, so that we can put an end to this and a violence-free world is possible. That's what we all believe in. So as part of, I'm unable to see, okay. So next slide, please.
Yes.
So Jahnavi spoke about it, that this is a global campaign, and it started on 25th of November till 10th of December. Next slide, please. Yeah, can you please do that Flow and HBT intervention? Yeah. Next. So next, please. Yes. So what we've done since 25th of October, we started with a nature campaign, and this till date, this is the figure that was reached till last night: 20,873 people had taken the pledge and signed this online signature campaign. We did 3 gender audits where young girls, adolescent girls, mapped their communities for safe and unsafe places and presented this to their ward members and to administration, to the local administration. There were awareness campaigns held in 3 states across 257 villages and 450 slums. Open mic programs have been done in communities with 2,500 women participating and speaking about their personal experiences of gender based violence. We've had street plays and door to door campaigns which reached 3,000 women and still counting, because as I speak, we're still having the campaign going on. 20 women casual workers were facilitated to get job cards, and 42 women street vendors were linked with Pradhan Mantri Swanidhi Yojana, a special microcredit facility for street vendors. 4,118 passengers in Bhubaneswar railway station were reached through railway station campaign. Virtual events were held by HPT and Flow, which reached to 3,800 people across the country. And charter of demands and recommendations were given to city and state government. So these are a few pictures of the gender audit and the door-to-door campaign and the street plays. Yeah, and the online, the signature campaign, and adolescent girls writing and doing painting competitions. We had painting competitions. Children wrote stories, poems, everything. So this is a campaign that that reached out to young boys and girls, to men, women, elderly, government officials, politicians, everyone. And it's ongoing. And tomorrow it will culminate in a larger campaign. Usually, it's a huge event on the 10th, but with the COVID restrictions, we're not going ahead. But we've already reached out to nearly 90,000 plus people and hope to reach out to 1 lakh by end of tomorrow. So that's from us. Thank you.
Yeah, that's fantastic. Thank you. Thank you for that, Dharitri. Makes us all aware about the tremendous work going on and so much else to do. Now, may I have, I would like to also show all of you how our Flow Kanpur chapter, Arti Gupta, reached out to students, to teachers first, and then to the students across the country with the message and training on behalf of Flow. We'd like to play a small video, please. Won't take it long. Arti, Anju, please play the video. Right. Thank you for that, Arti. Now over to Rashmi, please.
Thank you, ma'am. I'm privileged today to be introducing the esteemed panelists for today. Amita Pitre, the lead specialist, gender justice, Oxfam India. She has master's degree in public health and more than 17 years of work experience just one second. In the field of development, especially gender and health, gender equality, public health, and gender-based violence. She's a Fulbright Fellow 2016-17 and successfully completed her fellowship at Emory University, Atlanta in June 2017. Ms. Pitre is lead specialist gender justice at Oxfam India. She's nearly 20 years of work experience on gender violence against women and gender health. Oxfam works with women and communities to challenge negative social norms which justify violence faced by women. They also provide services to women facing violence and also advocates with governments for better implementation of laws to address violence against women. Our next speaker is Mary Thomas. She's a gender specialist from UNICEF. Mary works as a gender specialist in UNICEF and she has over 10 years of experience of working on women's and girls' rights and has worked with internationally affiliated organizations like Girl Effect, Oxfam, and HIVOS. She has experience in managing behavioral change programs and campaigns on child marriage, domestic violence, and life skills for young girls. In Oxfam, she led a multi-state program on domestic violence and also led the gender mainstreaming portfolio, which involved building capacities of partners and staff across different programs in Central and North India on gender issues. As the gender safeguarding lead in Girl Effect, she worked on designing digital content for young girls on employability and sexuality. More recently, Mary worked with Point of View and managed their projects on gender, sexuality, and technology. But before I hand over the mic to Anju Kapoor, the advocate and founder of AKMD Legal, co-chair of Flow Legal Cell, for context setting and moderation of the speakers. May I request President Flo to felicitate our speakers for the day.
Yes, thank you. So Anshu, would you please play the screen and show us the virtual mementos we have? In due course, our mementos will definitely reach you physically, but for now, this is a little token of our gratitude and for you giving us the time to be with us and share your stories. We're waiting for Anshu. Right. To Mary Thomas, Gender Specialist, UNICEF, a big thank you from all of us at Flow. Thank you. Next, please. To Amita Pitre, the Specialist, Gender Justice, Oxfam, India. Thank you on behalf of Flow. Thank you. Next. Yes.
Thank you, ma'am. Over to you, Anju.
Thank you, Rashmi. Just one second. I'll just do my screen share. Good evening, Janvi Pukun, President Flo, GB members, our esteemed speakers Amita Pitre and Mary Thomas, my colleagues at the Flow Legal Cell, members Flow, and all the participants. We are here today to speak about and speak against gender-based violence, and domestic violence is nothing but a facet of the gender-based violence. And this has become a menace, a problem which crosses all boundaries. Domestic violence knows no boundaries. It is beyond and it transcends all economic, cultural, racial, religious borders. It is known, a very well established fact, that domestic violence has a huge impact on women's health, and it has psychological, social, emotional ramifications on the victims and also on the society at large. The economic impact, the health sector impacts of gender violence are very, very large. They are enormous. A recent survey by the United Nations Population Fund shows that in India, more than 2/3 of married women face domestic violence. And it has also been reported that violence in India kills girls and women between 15 to 44 years of age as much as cancer does. And sadly, in India, it is reported that every violence episode of violence makes a woman lose 7 working days. So we can understand what is an impact it has on the economic life of the country. Why is it that domestic violence is so?
इसको कुछ क्या कर रही है माया दीदी किचन तो ऐसा लग रहा है इसने साफ किया
Somebody's mic is on. Anshu, could you
Yes.
please mute
We
everybody?
need everyone's mics to be off, please, all the members.
So domestic violence is a very complex phenomena, and what contributes to it is our cultural attitudes, our religious practices, social, economic, political policies, all perpetuate and contribute to domestic violence. And women sadly face domestic violence from birth, in their families where they are born, then in their married homes by their husband and also other family members. And we find that girls are usually in India in a position of, less privilege as compared to their brothers and other male members, as far as education and even material resources are concerned. But it is noted by most organizations working in the field of domestic violence that it largely goes unreported. And why is that? It is largely unreported because it has been normalized, it has been trivialized, and we normally just say, "Ye to ghar ki baat hai," ya ghar ki baat hai. So the social stigma attached, for a woman to go and complain against her husband or her father or other family members, it's a cultural, no, and women normally don't do it. And I think the most important thing is that women are largely unaware of the law and their rights when it comes to domestic violence and how the law protects them in our country. In India, our constitution guarantees right to life and a life of dignity to every person. And luckily, we have a law called the Protection of Women from the Domestic Violence Act, which was enacted in 2005. Under this act, the definition of domestic violence is very, very wide. It includes physical abuse, and physical abuse includes any kind of bodily harm or pain that can be caused to a woman, any danger to the life or limb or health of a woman, including psychological health. Also, anything which, hampers her growth, her development, and even intimidation, criminal intimidation, or even, threat of an assault is very much a part of domestic violence. Sexual abuse, which is any act or conduct which is of sexual nature, which humiliates a woman, degrades her, or violates her dignity, is a part of domestic violence. Then there is verbal and emotional abuse, so calling a woman by names, humiliating her. Something which is very common is, shaming her for not having a male child. All of this is part of domestic violence and should be understood as that. And then we have economic abuse, which is, not giving a woman economic resources to lead her life the way she wants to deny her the basic comforts, sell away or, do away with the property which is hers, her stridhan, any property in which she's a shareholder, joint holder, or if she's living in a house which is rented, refusing to paying the rent, alienating her belongings, or denying her a roof over her head is a part of the economic abuse. So this act basically protects every woman who lives in a domestic relationship in a shared household. By domestic relationship, we mean any kind of relationship which could be by blood, that is, brothers, sister, mothers, by marriage, or even by adoption. So basically, the act protects every woman. She might be a mother, a daughter, a widow, a live-in relationship partner, all women sisters are all included within the ambit of this act. So what it means, as I just said, domestic relationship covers all relationships by blood or by birth or adoption. And share household is any house where a woman lives with the abuser or has lived. So it could be a rented property, a parent's home, or any other property where she lives or has lived with the abuser. And it includes live-in relationships. What it means is a relationship where a man and woman hold themselves out as husband and wife for a period of time. They must be of marriageable age and should be able to qualify to enter into a marriage. So a woman who faces domestic violence in India can lodge a complaint with the police, or there are specially assigned protection officers in every state, or she can also file a complaint with the magistrate. Or any person who knows that a woman is facing or is aggrieved by domestic violence can file a complaint on her behalf. A protection officer is under duty to file a complaint so received to the magistrate, provide women a safe shelter, medical aid, legal help, and if there is any monetary compensation which she is to receive, the protection officer needs to ensure that she gets it and that the orders are, acted out. So a woman under a complaint of domestic violence can ask for a right to stay in the house, the shared household, stop the abuser from doing away with the property where she stays. You can even ask for directions for the abuser to be stopped from entering the household. She can ask for the custody of her children, any expenses that she needs to live a life of dignity, any compensation she may need for the damage or injuries she has received. And she has right to a safe shelter and medical aid in case she cannot get it from her family. And also, a magistrate additionally can stop the abuser from entering the place where she lives, a place she frequents, the school of her children if she feels a threat to them, and also any other place the children visit. The abuser can be even stopped from communicating from the victim and her children. In spite of this law, we find that domestic violence has been on a rise. Recent surveys show that women, more than 30-40% of women face the violence. Plus, the COVID times have seen a huge rise in domestic violence cases. And almost 75% of women, they say, do not report this violence. In COVID, between 25th March and 31st May itself, 1,477 complaints were registered. This is the graph that the cases have been on the rise. So we have experts here today to explain this phenomena. Amita Pitre, who is a specialist gender justice from Oxfam, would please share with us her experience and also shed some light as to why these cases have been on the rise during COVID times and what measures have been taken and can be taken to address domestic violence. Amita Pitre.
Thank you very much, Anju. So let me begin. I'll tell a little bit about Oxfam India. So we are a part of a confederate of Oxfam International, and there are several other Oxfams for various countries. And our basic stand is against discrimination and inequality of any kind. So similarly, even gender justice is an important part of our work. Mary here has worked with Oxfam India earlier, so I know her and she knows also about our work. So with that, I would like to begin what I want to say today. So Oxfam also has a really large humanitarian program. So we have seen the COVID crisis from up close. So I thought I will start by sharing my thoughts about that. What is now clear is that the COVID crisis was a profoundly unequal crisis. It is a fallacy which people thought this is a virus and it will affect men, women, rich, poor, richer countries, poorer countries equally. But we have seen that the socio-economic impact of COVID has been far from equal. It has been something which has actually brought out the fault lines of our society. Mostly though businesses went down and incomes went down for the better off in society, they have been fast recovering from it and they have also had a package to fall back on. whereas the really most marginalized and poor in the community have suffered and they continue to suffer, and we really don't know, like the parliament said, they don't have numbers about the migrants. Similarly, we have a data crisis which doesn't allow us to know the real misery on the ground. So one of the fault lines which COVID actually brought up is the increase in violence against women that has happened in society. Very often it was projected only as domestic violence. Domestic violence was a very big part of it. Is there a disturbance? Can you hear me? Should I continue?
Yes, please. Yes, sorry.
Okay. So domestic violence was certainly a big part in which the gender differences and the gender differences in the impact of the crisis came up, because women were trapped in their own homes with the perpetrators, and it was like a double whammy, which our own assessment on the ground level shows, because not only were they not able to escape their own homes, but at the same time the transportation was closed. Because of being trapped with the perpetrators in the house, many of them could not access the phone, they could not access mobile services. For many, escape to the natal home used to be a big relief, and unfortunately transportation and everything was closed down. So this was a major way in which women were affected, but it would be really wrong to reduce violence faced by women into domestic violence, because this is a spectrum, and it is actually better understood as gender-based violence, because that is the way society is organized around what should be your gender roles, how should a woman be, how should a man be, and that is the root cause of violence. And so we prefer to call it gender-based violence, but actually within gender-based violence you will find that we don't really do justice to the entire trans community, which also faces a lot of violence. So in this particular presentation, and because we are also talking in the context of 16 days of activism, I'm going to restrict to calling it violence against women. So not only did we face this, but we also saw that the unpaid care work by women increased phenomenally. So we need to understand violence against women as well as domestic violence within the general subordination of women. And when we look at socio-economic impact of this violence, we also need to understand that one part of the root cause of violence is that unpaid care work within the home, the domestic chores, the child minding, the cooking, the fetching water, the cleaning is all considered women's work. And that is one important reason why women are not able to take up paid care outside the home. And besides, unpaid care work is of course not even counted towards your gross domestic product, and so you don't even quantify. The recent NSO report has brought out how women's work is not counted. But I'm digressing here. What I wanted to say is the whole idea of violence faced by women and unpaid care work is connected. And it is this inequality in the home space which has actually also exacerbated the violence in the COVID crisis, but it has also perpetuated women's subordination so that they are not able to escape the cycle of violence. Now, to move on from there, there has been a lot of discussion about whether violence increased in the COVID crisis. And there are two stories here. One is some of the data released by the National Commission of Women and by other civil society organizations, which clearly shows there is two kinds of comparisons that were made 25 days before the lockdown and 25 days after the lockdown, as well as Professor Ashwini Deshpande had really done the also the analysis of the same time period in 2019 and 2020, and it clearly came out that the help seeking which is available in the form of data publicly, you could see numbers of violence increasing. But we also saw the other picture in our own data systems, which showed that women wanted to seek help but could not seek help. And one of the important areas that has come up very strongly is that if we really want to have an equal response to a crisis such as COVID, we need a gendered response. We need a response which actually puts women, men, all genders on par when they are responding. So if you remember the pictures of migrants, the TV coverage, the general coverage, it has been very gender neutral. And when you say it is gender neutral, it becomes a men's problem, and it becomes an entire masculine way in which the problem is defined and seen. And women were largely invisibilized for a long time. People felt, because death rates were more among men, people felt that women were not even getting infected. But now the numbers are much clearer. Women are equally getting infected by the virus. In fact, that is a different area of discussion altogether, the gendered crisis here. But violence was also neglected because nobody was looking at it as a crisis which affects different genders differently. And then there was also a discussion that this is a shadow pandemic. And we who work on this subject know very well what does a shadow pandemic means. It means that you have this big COVID pandemic, and then there is another pandemic which is shadowing this pandemic. So it gives you a sense that this did not exist earlier. But as Anju also spoke in her presentation, that we know this is an ongoing crisis. And globally, more than 1 in 3 women will face some form of violence in their lifetimes. Global figures show us that 47% of murders of women are committed by their intimate partners. They live in or husband or any kind of boyfriend, and less than 6% of such murders of men are committed by women. So very often we have the men's rights brigade come and say, you're not counting the status of men. So we have these figures to tell them. And in India also, we have very similar figures. About 33% of women say that they have faced violence of the domestic kind. And we have calculated, and it comes to more than 8 crore, more than 8.5 crores of women. And not just that, nearly 1 in 4 of these women will also face medical injuries. And what else did our ground level assessment tell us? One is that the Domestic Violence Act, which Anju just spoke about, that was almost not functional at all. There were no protection officers who were on working. Though on 25th of March, the Women and Child Development Ministry had given out a circular that all services for violence against women need to be working. But unfortunately, on the ground, this did not happen. Not only because a circular does not make it possible, but you need to facilitate these services in multiple ways. Like your medical services were termed as an essential service. Your grocery was termed as an essential service. That is not just a circular. For that, you have to have an entire standard operating procedures where the transportation will not be affected, where they will be given various kinds of identity cards, various concessions, so they can actually reach where they're supposed to reach. And one of our major demands is that violence services need to be categorized as essential services. They need active facilitation. A circular doesn't help. So many women found that it was not just that they were trapped with their perpetrators, but shelter homes were closed. Women were said that you cannot do overcrowding, we need to do social distancing, so go home to the homes which actually these women had left because they felt unsafe. So there were different kinds of barriers which women faced. On the ground level, what we saw in our own support centers, we found roughly the same. Our counselors were actually using their mobile phones as helplines. So that itself actually hampered a lot of the access of women, because these were not well publicized helplines from before. This was like a makeshift arrangement because we know that the lockdown was quite unplanned. So in that sense, women found it very difficult to access services, and yet in some of the centers which have good data, we find the same average number of women accessed our services. And this tells us that probably many more were actually trying to access. What else we found very different was that there were much more serious cases of violence coming in. And women were sending pictures on the mobile phones, pictures of burns, bites, more severe injuries. And probably this kind of injuries were earlier going directly to hospitals or going to some other centers which were better equipped and are our centers, which I'm talking about, are housed in the police stations. So probably this profile of cases were not coming to us earlier is one kind of interpretation. The other is women were in a really trapped situation and could not escape, which resulted in really more serious injuries. So that is something that remains to be actually looked at in more detail. But we also found young girls have said that their pictures were found online, their boyfriends or even boys whom they did not know so well were actually using it to blackmail them, and there were several such complaints. And then we also found in many places there were reports of child marriages and trafficking that were there. So among the policy recommendations we have, one is that violence services should be recognized as an essential service because the crisis is not really over yet, and laws, policies and programs need to function optimally besides prevention services, besides steps for preventing, and that includes working with men and boys and empowering girls and all of that. But towards that, we did an analysis to find, do we really have enough allocation? Do we really have enough funding? Leave aside everything else that needs to be in place so that violence services are available. And what we found is that the government has, in fact, there was a central scheme which was supporting the implementation of the Domestic Violence Act, and that has been stopped by the central government. Not only that, though we see that there is a budget outlay for women specific schemes, we use the term women specific schemes very purposefully because it's like the 181 helplines, the one-stop centers. These are the places where women can actually get services directly, and even the shelter homes, and those services are totally dedicated to women. So we know this money is most certainly going for the cause it is outlined. We found that 2009 crores is the union budget in 2020-21 given for this. But even then, if you look at it, it only counts to 0.07% of the union budget and only 30 rupees per capita for the women population. So it is grossly less. And if we just look at women, if we calculate from extrapolation of data that 33%, 1 in 3 women face violence, it comes only to rupees 100 per woman. So it is grossly less. And then we also looked at the MEANTBYA fund, and we found that the allocation for the MEANTBYA fund, which actually the union budget I mentioned, a large part of it comes from the MEANTBYA fund and some from outside it. And we found that it has increased about 3 times from what it used to be 3 years back, which is a very welcome thing. But we also found that it has very poor utilization, and a lot of states, only 5 states were using more than 55% of the funds were going only to 5 states. So a lot of states are not really making use of this fund. And we also found something very worrying is that there is lack of transparency in how the funds are used. So 70% of the funds were going basically to the Home Ministry. And there is lack of, because Home Ministry really does not give the services like the Women and Child Ministry gives, which are the 181 helplines and one-stop centers. So a lot of these are going to services like CCTV cameras and the forensic laboratories and things which should have come as part of the police reforms and as part of general law enforcement. So our demand is also that there should be work, and when we calculated what would really be the quantum of funds required if we were to give these services, they would actually be available at the ground level too. And we calculated only 60% of women affected, because it is true that even if you wish for it, all 100% of women may not be able to ever overcome their individual whatever and social discrimination to be able to face, to be able to access these services. Even then, we need to be giving out about 10 to 11,000 crores per year for violence services to actually be able to be functional and be out there. And we also believe that a large part of these funds need to be coming from the central government, because as you see, the state governments are already short of cash because there have been different kinds of challenges they have been facing, and then the COVID crisis. So it is the central government which will need to be taking the lead in this. So those are our major policy, those are our major policy recommendations. And I would also request you to follow our campaign online, which says empowerment, not age. And if you look at it, you will see it is a different kind of campaign. It's not exactly on violence against women, but I would really want you to follow that one too. Thank you.
Thank you, Amita. I mean, really, that was a lot of information. I think we'll take some time to process it, but I think we all need to hear all this, because sitting at homes and the way the government talks about it, they make it look like a lot is being done. But as you correctly said, that it is just there on paper and it's not really percolating down. So now we have Mary Thomas from UNICEF, who would be talking about the impact of domestic violence on families and particularly on children. Mary, over to you.
Thank you, Anju. Thank you, Janvi and Anju, for inviting me. Really a pleasure to be here, and really great to be sharing this space with Amita. Hi, Amita. Uh, just, just a bit around me, as already been introduced, that I'm Mary. I work in UNICEF as a gender specialist. We two of us in the gender team. So my supervisor, who's a gender lead, Antara, and me, and we support all the teams in terms of being a cross-cutting role. UNICEF, as you might know, is a child rights agency, and we work around the entire life cycle of a child. So in terms of issues of education, health, WASH, which is water and sanitation, social protection, etc. So a lot of issues that we work around child rights. Um, what I'll try and cover today is mostly in terms of what are the implications around domestic violence for children and families, what has been some of our work, what are the challenges we have faced around this, and what are some possible solutions that we have looked at, and also in terms of what can be really done around this issue. To start with, we done a study a few years ago and around this issue of domestic violence. Of course, as a child rights agency, our focus is more around violence against children. But we could clearly see the linkages of domestic violence with children. And what our analysis came out was that one of the biggest sufferers of domestic violence are the little children, our children who really have those implications which really get invisibilized. To give you a bit of sense of the data around this, globally, it's said about 275 million children are exposed to violence at homes. In India, this is pegged at 27 to 69 million children. That's about 6 crore children being exposed to domestic violence. These are a little dated figures, to be honest. So it can be much more, and the COVID has really kind of worsened the situation. So there are much more number of children who are witnessing domestic violence and also facing violence in private spaces. 27, I mean, Anju shared the figures around the national figures around domestic violence. What we've also seen is that 27% girls who've been married have faced domestic violence from the age of 15 years. So as much as this is an issue of women, it's also an issue of girls, it's an issue of children, because the implications have really a ripple effect. Childline has also seen about 50% increase in the calls. Childline is a helpline for children. Actually, we should be seeing these numbers really together in terms of when we see the domestic violence cases that National Commission Women have reported, the childline cases that children have reported to. They're all very synergized, and often we see them in very different spheres. But violence against children and domestic violence are very interlinked issues that often we do not really see through. What are some implications? Actually, there's very little evidence also in terms of what are the implications around domestic violence for children and families. There's been one study where we've seen in North America where about children who witnessed domestic violence are 15% more likely to be assaulted or to be perpetrators. So I think that's one of the biggest things, because you're witnessing domestic violence, you're more likely to kind of, accept certain ways of tolerating and normalizing this behavior, and also as boys, role modeling their male relatives and being perpetrating it. And that's one of the biggest risks to call out. It also does significant harm to children in terms of their education, so lesser attention span, also in terms of being able to kind of their own well-being, their health. They're more like in families where we see that domestic violence is high, there are also a lot of negative coping practices that usually happen. So, for example, in terms of early marriage, also more susceptible to child labor, trafficking. This is also because when you see what happens in where cases of domestic violence or domestic violence is quite high in the families, the agency of the mother, the decision-making part of the mother is much low. Decisions are taken more by the men or the male relatives, and women have very little say. And that really impacts the well-being of children from their health, education, and even in terms of how they perpetuate or become victims of domestic violence. So I think this has been really pointed out by both Anju and Amita that the effects of domestic violence are not just in the here and now, they are cyclical, they kind of spread through, not just for girls, but for boys as well. And also they are intergenerational. So you see the manifestations as children grow older and in their own relationships. In terms of what can be really done around this issue, I think what do children really need when the COVID crisis started and when the lockdown happened? One of the first few things we did was to have a consultation with women's rights organizations and child rights organizations, understand what the issues were really are. I won't get into them because I think Amita has kind of really spoken about them really elaborately. We heard the same thing as the fact that GBV services or gender-based violence services not being considered as essential services, being the crux of it, or the fact that women and children who wanted to access support were not being able to do it. So the first thing we did was create a lot of communication around posters and using different medias to be able to generate awareness around helplines, information about gender-based violence, about domestic violence and its implications on children. We also did videos. Our messaging was also kind of focused on parents, because as much as we realize that we need to speak about the issue and also focus on women who are more likely to be survivors and victims, but we also need to speak to parents in terms of helping them understand the implications of having a more violence-free homes. So a lot of our communications was actually targeted to both the mother and father in terms of what is really the importance of having violence-free homes, how can you do that during COVID times. We had a lot of parenting modules that we developed during this time. The other big thing we did was around training frontline workers. This came across, we already see that, the frontline workers, the gender-based violence workers are already exhausted because, as Amita said, it's been a shadow pandemic. And we really focused in terms of training them around, one, the issues that they'd have to kind of look at in COVID times, how to adapt this in terms of being able to take what was physical to now virtual, so more telephone counseling, also looking at what kind of services they need, also advocate with the government to be able to see if shelter homes can be, in terms of accommodate survivors of both women and children. And we were really focused in terms of training the frontline workers. One bit what we saw was the mental health issues and the recognition that this was a big one, even for frontline workers, both that they needed capacities to deal with this for the clients and women and children who came to them, but also to be able to deal with their own mental health issues because of the workload. So this was one primary area, if you ask us, we've been really focused on, is to be able to train and equip the frontline workers and do this digitally, because of course we were all kind of learning to adapt in new ways, and being able to do this at scale for frontline workers, for service workers, was quite a bit of a challenge. One other thing what we realized was the lack of safe spaces for children to talk about these issues. And to be honest, in COVID times, it was tough to be able to even create these spaces for children. And the fact that schools were closed, girls were more likely to have, as Amita said, that, the unpaid care, or in terms of the household chores and sibling care burden, was increased a lot on women and girls. All this has really kind of created a sense of stress among girls. There's also, like, cases of child marriage were increasing. So we were not just dealing with one issue, but we were dealing with different kinds of issues around girls, and the fact that the girl was being much more vulnerable around this, and the fact that violence was happening both in private spaces and, of course, in terms of public spaces that we already see that's happening. In terms of safe spaces, what UNICEF has done earlier was we used an edutainment approach to it, where we had something called Meena Munch, and we've used radio and TV, and there's a Meena series in which it's a more animated series and talks about social issues concerning children around nutrition and education. But we also created clubs for girls. Having these support spaces for girls and boys and for children otherwise has been really effective. We found that these spaces have really helped them to be able to go beyond the shame and stigma and to be able to talk about these issues. And just in fact, that when we speak about domestic violence, the focus is always on the women, but the implications on children, do they have those spaces to be able to talk about it freely? Do they have a trusted adult in the family or in the school or in the community to be able to talk about how they feel about it, or if they are going through abuse? So I think creating those safe spaces is really essential and something we are also kind of looking at. As I said, the other one is about making parents aware of the implications. Often, with domestic violence, it becomes easier when you talk about it from the implications of children. I've seen many campaigns do that really well in terms of being able to talk about the implications. We often, focus on the women, which is very important because she's facing it, and also in terms of the perpetrator and the law and the redressal mechanisms. A lot is also needed to be done in terms of the prevention mechanism. When we say the prevention, it has to be again at a very at different levels and also in different interventions. For example, at the school level, we UNICEF collaborated with the Beti Bachao Beti Padhao, and we kind of started with some few government schools in Haryana, where we did gender sensitization sessions with young students. And we really saw the difference in say a year or so, to be able to kind of see how they were more appreciative of the work that their mothers have done. Boys were more appreciative also the fact that they didn't see certain skills like singing, dancing as only feminine, or drawing. So in terms of how they shifted in terms of seeing some of these attributes, in terms of how roles, they kind of value some of these roles that have been done by their mother, also in terms of acceptance of violence really reducing. Not just that, children also have the ability to be able to kind of transfer these learnings to their parents and families. I remember in my times in Oxfam, we used this example a lot, where when the We Can campaign on domestic violence was done, we heard some cases where the girl actually, took the mother and said, "We have to go to the police station. You can't be going through this." So children as carriers of change are really important, and to be able to kind of use, the education settings, community settings, in terms of messaging around not just, of course, around gender and gender issues, but also in terms of domestic violence. As taking inspiration from one of yours, Teach Them Young, is really important. So when we focus on domestic violence, I think our focus should not just be the women, but it also has to be around the family and also in terms of men and boys. Again, there, in terms of having normative shifts in men and boys, for them to realize that this is not normal, this is not what is accepted. Domestic violence is not a way to resolve a matter. Is something that you have to teach them really young. So we've also got programs around positive masculinity. If you see our series on Doordarshan called Aadha Full, we also have comics. So we use edutainment a lot in terms of being able to kind of speak a lot around social norms, around positive masculinity, around gender equity issues. We feel that's very important to be able to address in any approach around gender-based violence, because you have to work with the system, you have to work with the community, you have to work at different levels to be able to address this. With the private sector, we're working with them actually in terms of family-friendly policies, looking at how you can look at flexible work arrangements, and really shifting the focus from women as the caregiver to also the men. So looking at work from home, looking at paternity leave. Often, I remember again in Oxfam having this conversation, we see that men do not take paternity leave as much as women, of course, would take their maternity leave. So I think in terms of how do you shift these dynamics in our own workplaces, also having conversations on domestic violence and its implications on children in workplaces. In UNICEF, in middle of I think the whole crisis, we had our head speaking about domestic violence and saying that we really want to kind of, also talk about the fact that this might be an internal issue and not just what we're looking at externally. As a private sector, I think that's a space you can leverage the most, because you, as a private sector, you can really create evidence around the need for much more gender equitable and gender responsive policies around gender-based violence, and also in terms of having more equitable policies that really shift the norm and make it much more possible for women to work more productively and efficiently, and for men to take on roles. Yeah, and okay. I think I'll kind of end with just the fact that, I think, I'm sorry. Yeah, I think Janvi said it very well. It's really important for us to kind of look at some things, how we personally address this issue. Ring the bell is a fantastic way to be able to do it. Often it's not easy. I've worked on this issue, but for me to go and really ring the bell when I hear violence is difficult. But in any way, I think let's try and intervene in a way we can and offer help where we can. I can tell you a personal example where just about me, I've heard a domestic violence case, and I try to speak to people who know them, and they said in 3 years nobody has really reported this. So when we in buildings and societies, we hear people with loud music, and we kind of intervene, we call the police, but when it's a domestic violence case, we're all very silent. It's very difficult to intervene. But I think these are ways we really have to find to be able to address it both in our personal lives and also in our professional lives. And yeah, I think I'm also very glad that we've been able to focus on gender-based violence during emergencies. India has not really had this conversation during any other humanitarian crisis as much as it's in COVID. So there was an analysis that did that only 41 countries have looked at gender-based violence during an emergency. And now during COVID, that has doubled. So there's about 81 or 86 countries who are really looking at gender-based violence during emergencies. I think this is an opportunity for us to be able to look at approaches, what have not worked, because these are not things that have just started. These are just structural inequalities that we see have further worsened during COVID times. As Amita said, this is not something that started now. Domestic violence or gender-based violence has been there, but it's just kind of worsened now, and we're able to see this quite bare in front of us. And it's really up to us in terms of what approaches we can do using our professional power, our personal power to be able to address this issue, and also kind of focus on the implications of children. Yeah, I think that's all I had from my end. Over to you, Anju.
Thank you so much, Mary. I mean, really, thank you for bringing the focus onto children and girls. And, they are 15 or 13, and what they're going through at home is not spoken about. And how easily we shift the burden of, the domestic chores on the girl child, and we don't even think about it. So thank you so much, Amita and Mary, for discussing it in all the facets of domestic violence, and what a vicious cycle it is, starting from childhood, carrying into your married home, and then it's just going on, and how the boys in these houses become perpetrators. So I'm glad we could have a conversation on this today, and hopefully we can take it forward. And taking from what Mary said, let's each one of us do whatever we can. It doesn't matter how small or big that is. Thank you so much. Rashmi, over to you.
Thank you, Anju. Our next speaker is Priya Hingorani. She's the senior advocate, and she's also the chair of the Flow Legal Committee. May I request Priya ji to make her presentation on the...
Thank you, Rashmi. Thank you, Rashmi. I know it's been very, very enlightening hearing both Amita and Mary. Amita, it's good to know that you're a Fulbright scholar. I have been on the selection committee for many years for the Fulbright scholars many years ago. So really nice to know. And heartiest congratulations. It's a very prestigious scholarship to get. Also,
thank you.
And very nice to hear both of you. I've done a lot of work with Oxfam and UNICEF over the years, in my initial years as a lawyer. So I'm so happy to hear that you are doing such good work. I think we must compliment Janvi for this initiative that she has taken, taking us all through in these 16 days, and what wonderful programs have taken place. Thank you very much, Janvi and her team. It's a pleasure to see some of the past presidents who I have worked with very closely over the last few years. Well, I just would I know there's paucity of time. We have a lot of our participants, our members have questions to ask, and Mohini, co-chair of the committee, is also there to share her thoughts. I would just briefly say 3 or 4 things. First of all, as a lawyer practicing in family law and doing with my specialization in that, and also the kind of cases which come to me, and the fact that I have worked with the National Commission of Women, the Delhi Commission of Women, the NGOs over the years, seen the growth of the NGOs over the years in India, I must say that a lot of work is being done from the private sectors, from the NGO sectors, rather from the government. And that's the sad part in our country, that the government does not take onus of the welfare schemes or the schemes which should be there for women and children or the young girls. In courts, the picture is totally different. In courts, while we do say there is an act in place, there are protection officers in place, we have major infrastructural issues which we need to deal with on a daily basis. We have the judges are short in supply as compared to the cases which are coming up in courts. It has increased manyfold, as we all have spoken about it and aware of it. But some of the issues which I think which will be relevant for our members flow are, as was mentioned by Janvi, that this flow legal cell is an SOS cell with a helpline, with a good team of lawyers on the committee who are available 24/7 to help anyone in distress, whether it is related to violence against them or their family members. But I find that at workplace, when we're talking of social economic impact of this domestic violence, I find at the workplace we don't have too many systems in place to help them to to give redressal to their issues. We are either banking on the government helplines, or we are banking on individual lawyers or NGOs. When we talk of the corporates, when we talk of companies, within the companies, apart from the sexual harassment at workplace ICC cells, we do not have any of these kind of helplines available amongst the corporates to help women who are working in those companies or working in those corporates to get some kind of a support system there. And I think that's one thing, as a legal cell of flow, we are working on strengthening, that we should be able to, amongst our members, amongst the business houses which are part of flow, we have a system in place where women can come to, whether it is during the day or during the night, at 24/7 helpline. The other thing which I do want to very briefly mention is the fact that the judgments which are coming from the courts are absolutely laying down the guidelines, the law for in such kind of cases. The recent judgment passed by the Supreme Court in Rajneesh versus Neha, which has in detail, though of course that was the judgment on the decision of maintenance of under section 125 CRPC, but the Honorable Court of the bench led by Justice Indu Malhotra, who coincidentally inaugurated our legal cell, has in detail discussed the issue of maintenance, the issue of the overlapping jurisdictions between the Criminal Procedure Code and the Domestic Violence Act, and has discussed at length that a woman, if she goes under the Domestic Violence Act for maintenance, or the child goes, she is entitled to maintenance under the Domestic Violence Act as well as under the Criminal Procedure Code under Section 125. And I think that there were contradictory judgments across the country on that, but that has now been laid to rest by this judgment of the Supreme Court. And this actually is a landmark judgment as far as deciding about the quickness of the maintenance applications to be decided, the execution. And this is where actually women have been facing a lot of problems across the court. May not be so in the metro cities, but yes, in the smaller cities and the smaller places, these are big issues which have now been settled by the Supreme Court. A lot was mentioned by Amita on the funding which the government is giving, and by Mary about how young children and girls get affected in these kind of situations. It's absolutely true. But at the same time, when we are talking of gender sensitization, I think there is that is where we are lacking a lot in our country. The mindset has to be changed, and unfortunately, despite the kind of work we are all doing in different parts spheres, the issue of awareness and the change of mindset is something which is taking a lot of time to come through, and I think that's very important. Our emphasis from Flow also should be, and I mean, I'm sure Oxfam and UNICEF is working on that as well, on changing the mindset, as Victor said, start young, start in schools, but basically I feel start at home. So these are a few thoughts which I did want to share. I know time is short, and I'm going to looking forward to the question answer session that I think Mohini is going to be moderating. Thank you.
Thank you. We now have Mohini ji, our co-chair for the Flow Legal Committee, to moderate the questions. Over to you, Mohini ji. Any questions, audience? You can please raise your hand or put it in the chat box.
Yes. Thank you, Priya. And yes, we have about 10 minutes for this, but I think it's we are still short of time. There was one question which was in the chat box. So I think that has been already answered by Amita. And are there any other questions that you would like to ask the panelists?
Well, Mohini, have a question from you, from our past president, Surekha Kothari. Yes. She wants to know that can security apps, are there any security apps for the safety of women? The rules on paper don't count unless there is a recourse and a task force to ensure justice is not done. So can you explain what is available?
Janavi, I think that question has been answered by Amita. As mentioned about safetypin.com, which is one of the apps. And would you like to explain, Amita, more about that, on that question?
Yeah. So actually, there are two aspects to it. There are some like safety pin, which I have mentioned, which actually map. So there is a possibility to actually then work over time to set right, if there is lighting required, if there are other measures required. So I am in favor of those kinds of things, but they are not really apps. Apps are some things like a trigger button on the mobile phones and things like that, which have been advocated a lot. But I feel that we have a long way to go over there, because this is fundamentally a social problem. And we should not think of apps as something that will solve the issue. There has to be far more fundamental things for safety of women in the public place, and similarly as to what we all discussed in the private space. The other thing, if there are no questions, I would just want to highlight a little bit about the private sector, because we are here in this group. And, once everyone had shifted to work from home, there were several reports of how work from home is very different for men and very different for women. And women were minding children and doing everything, unpaid care work at the same time. So from you, actually, I would like to listen, what do you think can be done so that, because we could be in a work from home kind of situation for a longest time. And if it really means an unequal workplace at home, then that is something we would not certainly want. So would like to know your thoughts on that.
There is one more question from Dr. Monica Barwa-Sakya. She is asking, how do you join this campaign? So Dr. Monica, can you be a little clear about what campaign, or basically, I think Janvi is talking about what we are doing here. So I think this question is to you, Janvi, so maybe you will be the right person to answer this.
Now she's in our Flow membership, and all our members are, yes, Monica, please reach out to us. Each and every member counts today for the 16 days and beyond campaign. And we are there to work with each other on this. So reach out to us. So from the legal standpoint, please, members, ask your questions.
Any other participants who would like to ask any questions from any of the panelists, please? Can I ask one? I don't think we have any questions in the chat box, but the floor is still open for any questions.
So how do family courts handle abuse and the violence issues? Are they effective enough?
Priya, can you answer this question from Janabi? Priya? I think Priya is not there. Anju, can you answer this question, please?
Hi, family courts, of course, have, if we talk from the times and where we stand today, have actually become more effective, have become more sensitive as to how, the witnesses are, or how statements are recorded, how you speak to the women, how you speak to the victims, could be children. And there's a lot happening, which is, now in closed doors or even via video screening. But, as Amita and Mary especially pointed out, that there's a lot more still to be done. I mean, though there are steps being taken forward, but, even from the Ministry of Women and Child, there are a lot of circulars and a lot of policies which keep getting announced. But sadly, it is all, on paper, and it is not really percolating down. So that is why the work which various organizations are doing is so much more important. And even, awakening the judiciary to how, sensitive these matters are. Sometimes we feel that sensitivity lacks. And that is something, again, we've been working off. And of late, if you see, there have been a lot of articles where they've said that the judges themselves need some sensitization classes on, how to, on gender and women and what their problems are. That our judges themselves, especially if they are men, sometimes they feel it's been reported that sensitivity is lacking. So a lot is being done, but there is a very, very long road ahead. That's what I would like to say.
Thank you, Anju. Thank you very much. There is one more question. How about flashing the SOS phone number frequently for public awareness on TVs? Yes. So are there any campaigns or anything which is going on to that?
That's a good point. We take note of that.
Yeah. So any more questions on the floor? I don't think so. Janavi, I think I'll hand it over to you for your concluding remarks. So,
Monica, is there any would you like to give the concluding remarks? I would just like to mention.
Ma'am, can I just intervene? I think we missed Amita ji's question that came to us, saying that probably we'll be in the working from home scenario for the longest time of our lives. So does that mean that there'll be disadvantage for the women? And so Janvi ma'am, would you want to take that question, or Anju, would you like to take the question?
Yes, Amita, I mean, you know as much that if it's when we speak about work from home, as far as from the organization's point of view, a lot of work is being done and there has been a lot written, and there has also been talk, as to how companies should look at redefining their policies as to make space or special criteria defining, because some of the complaints that I have seen have come is, women being asked to switch on their cameras at 10 in the night, comments being passed, or men just talking about how lonely they feel. So a lot needs to be done where companies and organizations need to rework the policies that they've had, as in to, come up with special measures to address the work from home scenario. And at home themselves, I think it's also a huge burden on women to be able to take a stand and draw a line as to what exactly is, work at home with work from home, because I think it's doubled, the women's work at home is doubled, and with kids being home 24/7 now, the work is endless. So that is something I think every company, every employer now needs to look and redefine in their own policies.
I have a question to Amita and Mary. So it's little general questions. What are some of the ways in which women can be encouraged to report domestic violence, given that a major reason why they don't report it is because of concerns regarding their families and the social stigma? So Amita, will you be able to answer this question?
Yeah, I will tell you. So basically, there are two aspects to it. We do work a lot on social norms which hold women back. So there are a lot of pati ne ek thappad maar diya to kya baat hui, that kind of thing. And in the National Family Health Survey itself, you find women actually holding these views more than men. So it is something that has been socialized, that women don't talk about things which happen at home. So that's one reason. But the other reason is also availability of services. We've seen where we run services that as soon as there's a well functional service which is women centered, which is good, if the service tells the woman it's your fault and go home, that service will not attract many women. But where we find good services available, women do go in large numbers. So a lot of our understanding that women don't access services is probably because there are very few services which are, set in such a way that, there should be confidentiality, there should be privacy, and there should not be victim blaming, there should not be judgmentality, etc. Otherwise, women do go to services. And of course, we need to work a lot more on socialization so that women think that this is like, I think Janvi mentioned, it's a human rights violation.
Thank you, Amita. There's one more question from Aarti Gupta. Is there a policy or guideline in place for cyber assault now that it's increasing with WFH increasing? Work from home.
Yeah.
Work from home is increasing.
Yeah. So one of the lawyers, do they want to answer this?
Anju, would you like to answer?
Can you, there was a little disturbance. Can you quickly repeat the question, please?
So the question is there a policy or a guideline in place for cyber assault now that it is increasing with work from home increasing?
Yes, of course. As I just said that, when we speak about violence takes it to its ambit, all of it. And then we have the Information Technology Act, which clearly talks about, cyber bullying, cyber harassment, all of that is covered. And then from work from home, as I just said, the POSH Act makes it clear that every employer is to have a policy on sexual harassment, which needs to be clearly circulated amongst all employees. So in the present scenario, that onus is on the employer to include cyber assault, cyber bullying, and any other cyber related issues, and expand its policy, circulate it, and let it be known to all that such acts would amount to, an infringement of the office policy. And it should be absolutely, there should be no tolerance about it. It should be zero tolerance policy, but that onus is on the employers. And also, I think the ICC members in every organization need to know more about the law. And also, I think, read up on the Information Technology Act, because then otherwise there's a gap. So as a woman, if I complain about something on the cyber or the social media or a WhatsApp thing, so if the ICC members are not trained on cyber laws, then there is a gap. So that the employers need to do. And then it is again mandatory under the POSH Act to have regular trainings of the ICC members. So that training is important to date, that it should include the Information Technology Act also.
Thank you, Anju. Rashmi, do we have more time to take one more question?
Yes, please.
Okay, so there's one more question from Ruchika Malhotra. Please give details of the magistrate where complaints against domestic violence be reported in case we find such a situation in the neighborhood. Again to Anju, I think.
So, that complaint can be registered to begin with from a normal police station itself. You can go to the nearest police station and lodge a complaint. Then, as I said about protection officers, but then Amita also was quick to point out that again, that there are not many, but you can always visit the web pages of the Ministry of Women and Child. And then, of course, magistrate is the local court in your area. You can send that complaint to any magistrate. There's no such thing that you cannot reach out. So you can reach out to the magistrate or the nearest court in your area and file a complaint. But you could just start from even the nearest police station. That should also do.
I could just add a little bit here. Is that okay?
Yes, please.
So actually the entire purpose of the Domestic Violence Act was so that you need not go to the police, because women are often averse to going to the police. So there are protection officers, there are service providers, and there are hospitals. All three of them have the are charged with noting down the domestic incidents report. Like you have the FIR in the police station, because it's a criminal kind of act under which those cases come. And here it's a civil act where you have to file a domestic incidents report. So what we really need to ask, because what Anju clearly said is that there is a mechanism, but what do people know where to approach? They will approach the police, nowhere else. So we really need to publicize these service providers, these protection officers, so that the number is available there. You can directly call the person and totally can bypass the police system, which is sometimes stigmatizing for women.
This is very interesting regarding protection officers. We didn't know about it. There are some more questions. Please take that, Mohini.
I think
Deepika Sood.
I don't think there are any more questions.
No, there is one from Deepika Sood.
Deepika, certainly there needs to be addressed very much. So I don't think there is any question from
there are. There is one from
Telangana is really very good service to reach out. So
yeah,
Lipika, the other women pull down the women. What she's saying that, of course, generally this is what happens when women pull down the other women. So how does one deal with one's own other women family members' attitude? So how do you deal in that case?
Yeah.
Just to add there that I mean, of course, one is the attitude, but also in law, under the act, it's not that you can only register a complaint against a male member. If you're facing violence, which is also verbal abuse and mental torture at the hands of a woman family member, you can also, that would also be very much within the ambit of law, and a complaint can also be registered against that. So it is not just limited to violence by men in the family.
Okay.
Thank you, Anju.
To add to that, if I might.
Yes, go ahead, Mary.
Yeah, I think that's also the reason why when we look at domestic violence programs and, when we look at being able to design those programs, it's important that they're not just women-centric. We are talking to the father, we're talking to the boys, we're talking to the adolescent girls, we're talking to the service providers, we're talking to the communities. It's very important to have very comprehensive programs of domestic violence, because it's often very difficult for a woman to go and report on her own. She needs that support system to be able to enable her. And if you don't create that support system, it's often it's going to fall back on her. So I think that's also a very important aspect when we look at preventive programs on domestic violence.
Thank you, Mary. Thank you, Amita.
Mary, I want to address Lipika's question a bit more about what can be done in the family.
Sure. I think I kind of spoke about this a bit in the fact that it's very important to be able to speak to parents around the fact in terms of what really violence does to the children. What does it do in terms of the family, in terms of being able to break the routine of the child, to be able to create a lot of distress on the children. We've really focused on this in terms of having a positive parenting program. And this is not just in terms of looking at a standalone program, but in terms of looking at this in different aspects of our work. So in terms of nutrition, in terms of water and sanitation. So in all these areas where we work in programs, we look at how do we kind of promote messaging around positive parenting. I think that's one bit that we do. The second is in terms of focusing around social, gender socialization and gender sensitization, especially in the education setting. Much has been said in terms of teaching them young. So I think being able to kind of inculcate that of not normalizing domestic violence is very important. And COVID has really kind of made this home, the school, it has made the space where, everything is happening. So it was really important to be able to engage with the parents, with the community people, to be able to see how you can support children and also parents around these issues. I think a lot of our communication, a lot of intervention really focused a lot around that, especially during COVID times. Other than that, of course, safe spaces where girls and boys can discuss these issues. Even a 1-week session classes have really impacted in terms of how you could see smaller shifts in terms of, attitudes of how they see their, how do they perceive things around violence, how do they kind of also see, the fact that there's a benefit in terms of having much more gender equal relationships. So I think, as I said, it's a multi kind of approach in terms of looking at also working with with the system as well, and to be able to change their own mindset about this, because the touch point of anything, be it hospitals, be it police stations, are where women go in absolute urgency, in absolute distress, and those are places where they need the support in terms of being able to get that urgent support. So be able to make mind shifts there. So I said it has to be a multi-sectoral approach, and of course within the family. But in COVID times, we really focused around home and looking at parents as a being able to kind of change their mindset around this.
There's another question from Dr. Monica Barwa. I think this, Mary, you had touched upon this subject. What do we do when we are reporting about domestic violence happening in the neighborhood, especially when the neighbor is not willing to come forward about it?
So, the same thing happened at my end. What I really did was, to be honest, I didn't have the courage to go and ring the bell. As much as, it is an effective strategy, and it's also COVID times, you don't want to put yourself at risk. I really went and spoke to somebody who kind of knew them, and to be able to kind of convey this issue, and also kind of peg it in terms of the fact that the couple had young children and the effect around it. And they kind of then spoke to the family about it. There are different ways you can do. I've been in trains where you've seen girls really beaten up, and I asked really what happened, and they wouldn't answer. And I said, okay, I just given a helpline number. Often, if you can just write down a helpline number and give it, have that handy with you, or you can just Google it, but intervene in any way possible. It is embarrassing, it is difficult, it takes courage, but there's no harm in asking somebody if they need help. Often it is difficult. A woman or a child will not come forthcoming and say they need help. But if you give them a helpline number, perhaps they might reach out to that. So I think you have to use different ways to be able to deal with it and see what you're most comfortable with. But I would encourage being able to intervene and offer help in any way you can.
Thank you, Mary. There's one more question from Shivani. How to deal with a domestic violence case when husband is living out of the country and not keeping the wife with him?
I think Amita and Anju can answer this better.
So he's living out of the country. Who's the domestic violence against?
If the violence is coming from the family, as I said, it is very much, the Domestic Violence Act is not saying that they will only take complaints against a husband. It could be anybody you are living with. As I said, it's a shared household concept. So if you're living with the abuser, man or woman, you can file a complaint. Police, magistrate, protection officer, and all the mechanisms are available. And again, it's not just the victim. Anybody can approach and file a complaint on these forums. It's not just the victim. She might be scared. She might be hesitant. So as Mary is saying, as a friend, as a neighbor, you can also reach out and file a complaint.
Very true. Thanks. I just add to that, sending your wife home when you are settled abroad itself is also a form of domestic violence. Yeah. So, and actually men sometimes do that to escape litigation in a developed country if they are settled over there. And this was taken up in a big way by the WCD, the Women and Child Development Ministry, and the National Commission for Women, because they were facing all these problems of NRIs with wives in India and the perpetrators or the accused abroad, and it is indeed very, very difficult for these women. And there are some Southall sisters in the UK and Manvi and organizations, and really we need to do more about this, because what happens is once there is a child, say if you are in the US or the UK, the best interest of the child is interpreted by their courts as being in a better developed country with the father who has a steady job, etc., versus being with the mother who you don't know whether she has an income. And for them, some country in South Asia, for example, doesn't seem to be as good for children. So here, women's rights are really getting affected because of citizenship issues and because of the two countries having incompatible laws. And this is an important area which actually more needs to be done.
Okay.
Thank you, Amita. Over to you, Janabi. Do we have any more time for the questions, or I thank you to Janabi for the concluding remarks?
I just want to say that we've learned so much today, and there's and it's a lot of no heartening news as such for us. So I know our responsibility in Flow, whatever little way we can contribute. I know that our legal team has promised us a newsletter for all these points that you've mentioned, that each of us who are educated women sitting in urban cities, we should have known better. I had no idea about the protection officers or the other important points that you all spoke about. So we are going to make sure that whatever points there are, simple highlighting awareness modules should be captured in our newsletters, besides the new legal acts that we were going to be doing. So I want to bring that to the attention of Anju and Priya, that please let us have these important, simple points that have been pointed out. Where does one go to? Who does one reach out to? We need to do more. All of us have a responsibility. So we've tried to capture the points the best we could, and we will keep asking you all for more inputs. And organizations such as Oxfam, as UNICEF, please join hands with us at Flow to spread the message. We are here to help. We have a large bandwidth of members in the private sector. Whatever we can do, we will do on our part. But if we all come together and join hands, we will drive this campaign beyond the 16 days that we've spoken about. Thank you.
Thank you, Janavi. Thank you, Janavi. So, of course, no doubt domestic violence is a pressing issue that spans countries and cultures. A report by WHO notes that 35% of all women in the world have been subjected to some form of domestic violence. In India, the number of domestic violence cases reported during lockdown has reached in the last 10 years for almost about 3 lakhs, almost 3 lakhs complaints. So this pandemic has shown us that policies implemented during the time such a lockdown measures and a prolonged period of working from home can have gendered impacts. A more sensitive approach to the social roles that women play, which is often hidden away in the private sphere, is need of the hour. I would like to express my heartfelt gratitude to Ms. Janavi Phukan, President Flow, Ms. Rashmi Sarita, Executive Director, for organizing this conference on the socio-economic impacts of domestic violence. It is a pressing issue that needs the immediate attention of lawyers, policymakers, and social workers. And the conference has enabled us all to engage with some of the important considerations that impact domestic violence. Thanks to Ms. Dharitri Patnaik, Bhubaneswar chapter, Ms. Aarti Gupta, Kanpur chapter. I would also like to thank our speakers for today, Ms. Anju Kapoor, advocate and founder AKMD Legal and co-chair of Legal Cell for FICCI Ladies Organization. Ms. Pitre, for your very insightful thoughts. It was crucial to highlight the gendered impacts of the pandemic and the inequality that has been exacerbated for the women. And Ms. Mary Thomas, thank you very much, Ms. Thomas, for highlighting the impact of domestic violence on children and acquainting us with the measures that UNICEF has taken to sensitize children. Ms. Priya Hingorani, Senior Advocate and Chair of the Legal Cell for FICCI Ladies Organization, for the insightful presentation. Finally, thanks to all the participants for attending the session and raising some important issues. Thank you very much.
Thank you. Thank you.
Thank you.
Thank you all. Before we leave, FICCI's 93rd AGM is around the corner on the 11th, and there's a huge expo that they have organized. I just wanted to run you through the AGM invite and the expo, so that if any of our members want to be a part of the expo, can definitely reach out to us. Anshu, if you could please play the video. It's a short video. Sorry for...
Is the video stuck or is it?
I think it is stuck, ma'am. Anshu?
So
Okay.
what?
Is it? It's
Yeah.
abrupt. I think I had a hung screen then. Well, thank you so much, all of you. Thank you for being here with us on such a pertinent topic today. Thank you all.
Thank you.
Okay, thank you very much. Thank you, team, legal team, speakers, and all our participants in 16 days of activism. Thank you. Goodbye. Now.
Good night.
Good night. Thank you, Mary.
Thank you.
Thank you.
Good night.
Thank you, Amita. Bye-bye.